Um, and thanks for that, everybody. I know it takes a few minutes, but I think, as I say, we've had a few new faces around the table today, so it's really worth just introducing ourselves. Now, as you'll all have seen, we've got quite a full agenda today, and Colin has kindly joined us to provide a little bit of an update on where things are at in Barrow. So I'm just wondering if everybody's comfortable, if we just move the notes of the last meeting down the agenda a little bit to give Colin the opportunity to have some time with us before he needs to leave, if that's okay with that. Yeah, silence is an agreement. In that case, Colin, I'm going to hand over to you to have a little bit of a chat about Barrow and where we're at as a borough.
Yeah, thanks very much, Tracy. And as I say, thanks for letting me gate crash this. When I caught up with Tracy on Friday, it just seemed like too good an opportunity, given that this meeting was happening anyway, just to catch up with people. And really what I want to do with this is three things. The first is quick and simple, and it's to say a huge thank you to everybody who's involved in this for all the work that you've been doing, particularly around COVID over the past, however long it is now, feels like ages. 5 to 6 months. It feels like it's been going on forever. The kind of work that's been happening through this sort of forum is just phenomenal, and it's been really important as part of the response. Just wanted to take the opportunity to say thank you for that. And the second thing I wanted to do was just spend a couple of minutes letting you know where things are up to in Barrow at the moment from my perspective, because stuff is shifting and changing, and Barrow's in a slightly different position from some of the rest of the Cumbria, so I wanted to give a brief update. But finally, and most importantly, I have to take the opportunity to listen to what you've got to say about what the situation is in Barrow, and to ask any questions that you might have about where we might be going next with everything. So it's mainly a kind of listening and question answering session, if that's all right. But I will just start off by saying a little bit about where things are at. Because as I'm sure people will have picked up last week, the Health Protection Board, which is a Cumbria-wide board focused on what we need to do to control COVID-19, took a look at the stats in Cumbria as a whole and agreed that we needed to put in place some slightly different measures in Barrow compared to the rest of the county. And the reason for that is that the number of cases in Barrow has been rising very quickly. Having had a situation where in July and August, Barrow had virtually nothing going on in terms of new cases. I mean, there were 8 cases in total over the whole of July and August. From the 31st of August onwards, cases started to rise very quickly, to the extent that we're now on about 35 cases a week, something along those lines on average. So it happened fairly fast. That pushes the rate of new cases in Barrow to, roughly speaking at the moment, about 55 new cases per 100,000 population per week, not including any of the testing that's being done via BAE, of which there is quite a lot. But that figure of 55 is much more comparable to other national and local statistics. Just to put that sort of figure into some sort of context, nationally we're looking at the rates being about 35. In Cumbria as a whole, in the other districts in Cumbria, it varies between about 7 and about 18. In the northwest as a whole, it's about 96. And the worst place in the northwest, which is also the worst place in the country, is Bolton, which is sitting on just under 200 per 100,000 per week. So you get the sense of the range of figures that we've got across the country. So Barrow looks like it's in quite a bad place compared to the rest of Cumbria, but not that bad a place compared to the rest of the northwest in many ways. But be that as it may, the speed in which things were changing in Barrow, and the fact that it wasn't all related to a single outbreak, what we could see was that there were lots of different things popping up here and there throughout the county, throughout the borough, that didn't appear to be connected to each other. So we felt that we needed to take action reasonably quickly, both to protect more vulnerable people and to try to reduce the transmission. So in Barrow now, we've taken 4 key steps. The hospital has instituted reduced visiting restrictions in the hospital because they've got an outbreak going on there and need to try to bring that under a degree of control. We've advised care homes that they should also be reducing their visiting and implementing new visitor restrictions. We've advised schools that they should not be bringing in any non-essential visitors into the school. And critically, we've advised people in Barrow that in addition to the national rule of 6, which people will be familiar with, that in Barrow, we think that people should not be socialising in groups of more than 2 households one time. Now, that's not a kind of nationally imposed lockdown on Barrow. There's no power to enforce that, but it's something that we're recommending to try to bring the spread of this virus under control. It's too early to tell. Obviously, we announced that on Thursday last week, so we're less than a week in. It's too early to tell whether that in itself is having a difference. Things do kind of, because if they've stabilised a little bit in the last couple of days, so we're not seeing a rising trend at the moment. It's fluctuating around about that 55 new cases per 100,000 per week. But that's the rationale for the decisions that we took to make that sort of recommendation. And on the back of that, as I say, when I was just catching up with Tracy about it, it seemed like it would be a good opportunity to have this conversation with you and make sure that you'd heard that from me about why we're making that recommendation, give you the opportunity to throw any thoughts, suggestions, advice back to me, anything that you think we can be doing differently to try and support things in Barrow, and ask any questions that you've got. So I'll shut up at that point and listen, take questions and comments. Thanks.
Thanks, Colin. Who's wanting to start off? Bill? I've got Bill, then Anne.
Bill, if you're talking, you're on mute.
I'm on you. Hello, can you hear me now?
I've got you now.
Got you.
Yeah, it's these earphones. Sorry about that. Yeah, thanks, Colin, for your update and keeping us all informed of what's going on. I know you do that on a daily basis, and it must be hard, the job you're in, but I mean, I know I can take that on board. Track and trace, Colin. We know across the country it's been a shambles, and it's pretty bad in Barrow as well. But my main concerns are schools. Now, a lot of children have been sent home at times, and some are getting sent home because other people have had it or have been diagnosed with it. And the children that's been sent home are left with, they don't know what to do. I had a case yesterday of one of my colleagues. His daughter was sent home because somebody in the school had it. She was sent home and they didn't know what to do, whether to go anywhere, keep her at home, or whatever. Is there anything we could get more information to people for that, Colin? Thank you.
Thanks, Bill. Yeah, schools are going to be a real challenge here, particularly as we go into the winter. And if we're in a situation where an individual case means that an entire bubble gets sent home, lots of kids might be finding themselves getting sent home on a fairly regular basis to isolate for a fortnight at a time. So we're very well aware this could be a really significant challenge for schools in future, because what the advice is, if somebody is tested positive, then the people who are close contacts identified as being part of that child's bubble should be self-isolating at home for 14 days. So I think there are two things about that. One is the disruption that causes to say family and the difficulty that creates, but also clearly the disruption that it creates for school and the impact on the child's schooling itself. So we're very well aware of that. I think that the challenge there is both for us getting the messages out and making sure people understand them, but also it's going to be for each individual school to work through how it manages to continue providing schooling and education for children who have been sent home to self-isolate. because this could happen quite a lot over the next 6 months, I think.
Yeah. Thanks, Colin. Thank you, Colin.
Thanks both. I've got Anne, then Dave Taylor.
Thank you, Tracy. Hi, Colin. And my question was very similar to Bill about schools. I am aware that some of the schools, they've got children wearing masks in corridors and some haven't. I do think, maybe we should look at that to see if we can give some advice to schools on that issue, because I really believe that, some schools have got children staying in the classroom and the staff moving around to teach them, in secondary schools especially. Others are just letting the children move around, but they're going out into corridors without face masks. I really think, maybe we should actually have a look at that, Colin, and see if we can give. I know we can't enforce anything, but maybe we can give them advice about the children maybe should be wearing masks at various stages in school. The other question that I wanted to ask, we had that meeting with the outbreak board, is that what it's called, and we came up with the proposals to put forward to help in Barrow. Has any of that changed due to the Prime Minister's announcement and what the government are doing? The announcements that we had last night from that, do we need to firm up anything further than what we're doing? Thank you.
Thanks, Anne. Talk to schools and see whether we need to strengthen it. You're right that it's not. We can't impose that on most schools at any rate. But we have certainly said that if teachers, if head teachers and governing bodies wanted to get people to wear masks in the corridor, for example, then we would support and encourage that. But we might be able to give a bit more of a strong message on that. I think that might be helpful. In terms of the government announcements yesterday, no, that doesn't impact on the decisions that we took within Barrow. I was actually expecting that the government might go down the two households socialising for everybody yesterday, but they've obviously decided not to take that step just yet. I think that will probably come in at some point within the next few weeks. I'm not sure that what they announced yesterday is going to quite slow things down enough. But no, Barrow, if people are following that guidance, is already a step ahead of that, I think.
Thanks, Colin. I've got Dave Taylor, then Lee.
Morning, Colin. Morning, everyone. Right, can I ask two questions?
Dave, you're on mute.
Am I? How do I get? Oh, right, sorry. How's that?
That's better, thank you.
Morning, everyone. Morning, Colin. Can I ask more than one question, or is it just one question?
Ask away.
Here they come. Right, I had one of the residents in touch with me this morning. Year 9 at Dowdale's, apparently there's been a COVID victim there, and the rest of the year have been sent home. Now, her question to me was, if this child has to go to hospital and has to stay in hospital, will she be able to visit and stay with the child, or will she be restricted from seeing that child?
No, if a child is in hospital, and the thing I would stress is that children, while we know that they can transmit it, generally speaking, are not badly affected by it. Quite often, they're not even symptomatic, and the number of children who end up in hospital is very, very small from all of this. But if a child ends up in hospital, the restrictions that there are at the moment still allow for a parent to be with the child in a paediatric situation, so they should still be able to visit and stay.
Right, okay, thank you. And more or less the same as what Anne was saying here. Is the current community programme, a campaign, is it having an effect? Right, we need clarity here on this, because there's likely to be a review. Is there going to be a review on the position for Barrow and Dalton on COVID this week for next week, and what the extra measures likely to be, and if anything's done, is it going to be borough wide or is it just by wards?
So we are of course keeping all of these measures under review, The intention was that we would put in place these recommendations for 2 weeks. So I would be looking to review them into the middle of next week before we make a decision on what happens, because it's a bit too early to tell at the moment whether it's made any substantial difference. If it looks like it's stable, then I would suggest that we might extend it for a little bit. If it looks like it's going up, we might ask people to do something else on top of that. The chances are we would do that on a borough basis rather than just by ward, because at the moment the spread that we're seeing is across the whole borough. It's not just in various bits of it. So we would probably do it across the whole borough, but that will depend on the pattern of the spread of infection at the time.
Right. We're using track and trace in the pubs and the clubs. Okay. How are we doing track and trace in things like supermarkets and shops and things like that? Do you know what I mean? Especially supermarkets. We had 2 cases in 2 pubs. Both pubs got shot anyway, but is there a set standard for pubs as well, that every pub must hit a minimum requirement, right, to keep the public safe? Because all pubs are getting mixed messages and they're all doing it differently. Some are doing it really well and others are just doing the minimum basic, and it's an interpretation from the landlord or landlady to the way they're doing it. Do we have the health HSE going round and checking on these places before they open to make sure everything's right? Would that not be a suggestion?
Yeah. So two strands to that. On the question of supermarkets, there isn't the same degree of test and trace in supermarkets at all. But what we're seeing in terms of the transmission is that it is very much associated with closer contact. So actually the odds of getting it from somebody in the supermarket are really quite small.
Okay.
Where we've seen transmission within supermarkets, it tends to be among staff who obviously are spending more time together, probably getting together at their tea break or something along those lines. That's where we're seeing it, rather than the kind of random passing somebody who got COVID-19 in the supermarket. When it comes to pubs and bars, as of today, yes, there are strict standards. That was one of the things that the government had announced. There have been COVID-secure guidelines in place. Pubs have been asked to do things. They've been told that they should do things, but it's not been something that has been really enforceable. As of today, it is enforceable. All hospitality industry, as of today, as of tomorrow, it will be enforceable. The Test and Trace app is launching tomorrow. As part of its functionality, it has the ability to read QR codes from smartphones. All venues will be required to have a QR code that people can scan into. They will also be required to collect information manually if people don't have a smartphone that they can use. They're required to keep data on, and that is now enforceable with up to a £10,000 fine. So we haven't had an enforcement power particularly up till now. What has been happening is that the Borough Council in particular has been working quite hard with licensees to encourage and support them to develop what they're doing. We know that that's worked really well. As you say, some places are doing it brilliantly, some places are not. But we're now in a position where we can actually enforce that.
Okay, Colin. Who exactly then is going to be going around enforcing this?
Well, that's conversations that are ongoing at the moment.
Right.
Because there is a bit of a challenge on the capacity. It's only as of tomorrow that the enforcement has been possible. And I know that the Borough Council does not have a large squad of enforcement officers to be able to go out and do all of this. Government did announce additional resources for local authorities and the police yesterday, but I haven't actually had a chance to see what that looks like. I don't know whether we know. Did they say about £60 million in total? How much of that's going to come to the police? How much of that's going to come to local authorities? No idea yet. So we're still at a bit of an early stage in working that out.
Thanks, Colin. Got quite a few people waiting, if that's okay.
Sorry.
To bring something. No, it's great. That's the whole purpose of today, to have that opportunity to raise any issues so we can feed that back out and clarify into the communities. I've got Lee, and then I've got David Cassidy next.
Thanks, JC. Hi, Colin. Can you hear me okay?
Yes, got you, Lee.
Right. Thanks for this, Colin. And I did say, I'm hoping some of the others take the opportunity to ask questions, because I think as councillors, and it's interesting, two councillors went first and they get more chances to talk to you than we do. I've got a few questions which sort of wrapped up a few things for, I think, the area. I'll try and be quick. A couple of things on testing. Firstly, we've had like a week-by-week update of the mobile testing centre being available in Barrow. Given our situation, can we make it a long-term commitment and get so the communication is important here, and to have that sort of facility permanently here, certainly while our rates are high and rising, I think it would be good to have a bit of a longer-term or medium-term plan for that, rather, because the comms will be going out on a week-by-week basis for that, and it might be for good reason. I know that testing the capacity is difficult. So and on a similar line. So firstly, the mobile testing, can it remain here while we're in the situation we're in, and we can get clear comms out? I believe that for schools, we try to implement where the hospital will test children by appointment. Has that been implemented okay, and is that working okay, and is that widely known by the schools okay, which I think some of the other people on this call might be able to answer. And I've got a couple more points. Do you want me to say those, or do you want me to wait?
Let me take those two before I forget them, and then you can come back. So in terms of the mobile testing units, yes, we absolutely agree that a longer term solution is what's needed. We're going to leave the MTU there, well, as long as we can, and we've got control over that. So while Barrow has the highest numbers, it makes absolute sense to leave the MTU where it is. But actually, coming into the winter months, actually we don't want tents up in places to oversee this stuff. We need something a bit more structured, a bit more rigid, and we're working on that at the moment, and working with the borough in terms of the location of that, but also with Mighty, the suppliers and Department of Health around what that actually look like. But we're definitely looking to get something longer term and a bit less flimsy than a tent in Barrow. And then in terms of schools, yes, that mechanism using Pillar 1 is in place. It has been working for schools, whether every school, and it's certainly been communicated out to every school, whether every school is actually aware of it, and if anybody's having any problems, then do let me know. But certainly it is in place, and it has been working for a number of schools.
Okay, I'll be quick. There's a couple of things we might wrap up to other people. For schools as well, I've picked up that some of the comms, I think last week you said about non-essential visits to school. There seems to be a bit of confusion over who is and isn't. I know at one school, for example, the music teacher said he was advised not to go in by the comms, but the yoga teacher went in. So I can see, yes, I know. So I don't know if it's a widespread problem, but certainly happened at my child's school, put it that way. And I know you acknowledged that the essential visits you considered were ones delivering things like mental health and well-being, as well as things like music. So it wasn't just curriculum. So I know you believed in that, but I just wanted to highlight that. And maybe if that's a problem, some of the other people on the call could talk about. Last thing, I promise. There seems to be, obviously there's new measures coming in place to encourage, I'll say, people self-isolating. So I won't make people aware on this line, but also ask you if you see that has been a problem up to now in the area, that people aren't self-isolating enough, because pretty soon it's going to be enforceable and there'll be financial help to encourage. So do you see that as a big problem? Do we have to push that quite hard?
Sorry, Lee, the first part of that broke up quite a bit. So I got from when you started saying self-isolating enough. So I guess the question was, we know that a number of people don't self-isolate, and that's part of the problem. Is that right?
Yeah, and do you think it's a problem here? I know nationally there's been saying it's a problem.
I'm sure it is. I don't have any evidence to suggest that it's any worse a problem in Barrow than it is anywhere else. But we do know anecdotally of examples of people who should have been self-isolating and haven't been. But that's, as I say, it's not constrained to Barrow. That is definitely something that's happening across the whole country. We definitely need to try to make sure that where people are advised to self-isolate, that they do so. And again, that's now going to be enforceable in law. That's going to be a challenge for the police. But in some ways, the messaging that says it's enforceable by law is really important, because that will in itself change people's behaviour. And frankly, where we get these anecdotal examples, it tends to be because people in the community recognise it and they see that somebody should be self-isolating and isn't, and they then come and tell us. So I think there's an element in which we really support the community enforcing this itself as much as anything else. We're not going to have police officers stationed outside just to make sure they're out. We're not that sort of society, and we wouldn't have the resources even if we were.
Yeah, thank you.
Thanks both. I've got David Cassidy, then Caroline.
Thanks, Tracy. Hi, Colin. This question sort of ties in with what's been said before. I run a programme working with school years 6, 7 and 8 for children that lack a lot of confidence, resilience, communication skills, etc. Now, we work across 15 primary schools, normally in this term, which we're not able to do at the moment because the schools don't want us mixing the children with different schools. But we've turned our attentions to see how we could support the new intake of year 7 children. And because they missed out on lots of transition work, and we were working towards putting a half-term trip together just to Broughton, to the Keppel Centre for outdoor education activities. We were going to take one school at a time rather than taking them all and mixing them. So maybe only 15 students over 2 buses. What are your thoughts about the pros of doing something like that at half-term, where it'd be a parental choice and not a official school trip? Because a lot of these kids won't have been out of town for 6 months, especially some of the poorer ones. Give the parents a break at half-term as well. So there's benefits from running it, but of course, in the current fluid environment, what's the safety risk of that?
There's a question on the safety risk. There's also probably a question on the legality of it, and I would need to follow that up and look at that in a bit more detail, because there are all these exemptions that say it's okay for some groups to be meeting in groups of more than 6, and where that proposal would stand in that, I'm not quite sure. I mean, I can absolutely understand the desire to do it, but you would need to be very careful that you are actually working within the COVID-19 guidelines and what is not just a guideline now, but the rules that have been set at a national level. I can, if you want to drop me an email about it, David, I can pick this up with you outside of here rather than trying to wing an answer on the spot.
Thank you, Colin.
Thanks both. I've got Caroline, then Janine.
Hi, yeah. I think the schools are doing an amazing job in this situation. It's really challenging for everybody, as you'll know. I know that head teachers are feeling very stressed at the moment. But my query, and I'm not really sure it's for you, Colin, but maybe someone else on the call, but to do with health. We're getting really increasingly worried about the impact that all of this is going to have on our budgets, because we're having to employ additional staff to keep bubbles of children safe. We've got additional cleaners, additional midday supervisors. We've got supply cover when staff's children are having to isolate from other schools, etc. The costs are mounting, and we can't claim anything back unless we're in a deficit budget position. And that, if this is going to go on for months and months, it is going to seriously take money away from what should be focused on teaching and learning. And whilst we absolutely want to do everything we can to keep our children's staff and families safe and do everything that you're guiding us to do, I just wonder if there can be some conversations somewhere about the impact for schools of of the finance, because it's another pressure that we really don't need.
No, I absolutely get that, Caroline, and I would absolutely echo that schools are doing an amazing job here. I wouldn't want to be a head teacher at any time, but I certainly wouldn't want to be a head teacher right now. I think it must be incredibly hard, and very stressful, as you say. So I take my hats off to every teacher, particularly every head, who's trying to run things at the moment. I mean, I think that the challenges that are being experienced around things like finance and staffing are clearly going to be real. And if this is going to carry on for 6 months, this is a national issue. There's going to need to be a national response to that, because it's not something we're not asking schools to do any more than happening at a national level. And this is the approach that's being taken across the whole country. And so I definitely think the government's going to have to take it seriously.
I certainly will put it on the agenda for Cumbria County Council's Cabinet, because we certainly can get it onto the National Local Government Association agenda. I'm sure it'll be the same with every authority that has actually got an education department within it. We'll be seeing the similar sort of thing. So I think, as Colin said, it is a national issue, but first of all, we've got to raise it as a Cumbrian issue, and I will do that, Caroline.
Thanks, Anne. Thanks all. We've got Janine, then Karen.
Hi, right. I'm just wanting a little bit of additional guidance really on youth work activity. I currently run Furness Multicultural Youth Forum, so we decided to come back and deliver youth club activities during the summer holidays. The only guidance that we seem to have that's really in depth is the NYA guidance, which is very in depth, and we've been running our sessions to that. I'm just wondering if there's any additional guidance that would come from you, Colin, and actually, to help Barrow. Are we at the point where it's just better to pull back again? I'm kind of really not knowing what to do with it at the moment. We have to run it quite regimented, like you do it at school, which isn't perfect for a youth club because that's not what they come for. Just, we're getting on with it. They're still enjoying it, but we want to be doing what's best. We know it's good for our young people to come out socialise, particularly our BAME community who don't have lots of outside social circles. So youth club is one of their main times to integrate and socialise. But they are from different schools, they are from different age groups. So, we want to make sure we're doing the best for our young people, but also the best for the community. So a bit of advice would be really welcomed.
But this is so hard, isn't it? I mean, I think it's really the key thing that I try to get to here is that this is about balance. It's still about balance. That if the only thing that you cared about was transmission of COVID, you wouldn't do what you're doing. But actually, that's not the only thing that we care about. It's really, really important. But so is the health and well-being, the mental health and the social health of children and young people. And that's why government is so strong in emphasising the importance of schools staying in. Again, you'd close schools tomorrow if you were only concerned about COVID transmission. But there's a lot more to it than that. So I don't think that we're at a point where I would be saying to you to do anything differently to the national guidance. And the national guidance is, well, again, it depends on exactly what you're doing, I think, doesn't it? But there are exemptions to the rule of 6 for organised activities around certain things. And so as long as you're following into those national guidance, I would say stick with that.
Yeah, and we've just implemented some more guidance for obviously following yesterday's update coming into Friday. So it will be parents won't be entering the building at all anymore. So we'll be dropping off and delivering kids to the front door. That kind of thing, separate the bubbles again to make them smaller again. But yeah, we just want to be doing the right thing because it's quite grey for youth work activity, I think.
Yeah, it's quite grey for quite a few areas, and one of the real challenges on this is that because what we're trying to do is balance things off, there are compromises being made that sometimes look as if they don't make any sense at all. So, you keep kids in a bubble at school, and then they all get in a school bus from different bubbles. My own kids are in 2 different bubbles. So in theory, they have to stay separate at school, but then they come home. So it doesn't look like it can't set a single simple rule that's set to I think we just need to learn to live with that. So again, if you've got any specific queries, do get in touch and we'll try to give you any specific support. But at the moment, you've got quite national guidance, I think, from the association. So work within that where you can.
Thank you.
Thanks, Colin. I've got Karen, then Julia.
If that was me, sorry Tracy, I'm fine. I haven't got a question. I think I raised my hand in error.
Oh, okay.
Sorry.
Thank you. Julia, then Roz.
Hi. So it was just kind of picking up on the point that Anne made about masks and that Lee made earlier about external visitors in schools. So obviously, from an Inspire point of view, I spent most of the start of September redeploying our staff back into schools because obviously the secondary schools had had letters from the DfE highlighting the importance of careers guidance and minimising the potential of young people becoming NEET, which is ever more important now given all of the current situation. And obviously schools have been fantastic and very supportive around that. And I do think that there is a little bit of a grey area around what is deemed to be essential visitor and not, because obviously we've got staff in and then, well, when we got the Barrow information that Tracy had sent out, then that sparked another conversation back with schools around, does this change anything your end? And obviously we've had some schools now where there has been a change and some that haven't. And I do think just clarifying what is around essential visitors. I'd probably say the majority of our schools see Inspire services to be essential because obviously our contract is a Cumbria County Council contract. But I just think it's worth sort of bearing that in mind. And the other thing I think is around the maths. So Anne, you mentioned about sort of changes and differences in maths. So obviously as part of every school meeting I've had to have before I'd even deploy a member of staff, we've had to obviously have a thorough COVID meeting. I feel like COVID's become a new full-time job. Just kind of like looking at the measures we've got in place and the measures that they have in place and making sure that meets both ends. And it is varied around the mask wearing, from different meetings that we've been in. We're obviously consistent from our end as to what our staff have to do and adhere to, and they've all got PPE, etc. But it was mixed, and I just thought I'd just point that out because obviously I've had to go through that process in those meetings. So.
Yeah, thanks, Julia. And if there's any lack of clarity, I'll pick that up with in terms of conversations with education colleagues, and we'll try and tighten up on the clarity about non-essential visits in particular. That's helpful.
Brilliant. Thank you.
Thanks both. I've got Roz, then Anne, then Vicky.
Hi, I've got 2 questions. One with my Resilience Hub hat on as far as this building is concerned on Walney. So this week, well, we tried last week, but it didn't happen with the new guidelines. So this week we have started trying to implement the youth work coming back into the building, which should have started last night properly with 2 groups, 2 bubbles, which are the same bubbles from four children in a bubble with 2 youth workers, the same bubbles that then 4 children are in at school to try and minimise. So we've done a lot of work around that. Sadly, both of them 2 bubbles that should have happened, both groups had been sent home from school, so that work has immediately stopped. But we were able to bring in 3 NEETs that actually came and met in the building that we're able to do that. My question for as far as the Resilience Hub, obviously we're supporting people in one end of our building, sending food parcels out. We've been really careful, having a limited number of volunteers, general public aren't in the building, etc, etc, etc. But then also in an evening trying to implement this youth work. I think my question is, if the youth work, if something happened that, you know, we had a case in the youth work side of the building that doesn't enter where the resilience hub is, would we have to shut the building?
No. In terms of shutting buildings, there's a limited amount of in which you would do that,
right.
Because it's not the sort of bug that really most of the time requires that. You might want to clean the place pretty well, but that's about it.
Right.
You know, a lot of the examples where we've seen buildings close, and somebody mentioned a couple of pubs that have closed, for example. That's not something that we've imposed on them.
Right.
That's something that the landlords decided to do because they were going to be out of staff, or you know, the landlord wasn't going to be able to be there themselves.
Right.
But no, you wouldn't have to. You know, even if there was something that went on within the youth work side of the building, you wouldn't need to close that either, as long as you clean it down, and then it could be reopened and fine the next day.
Brilliant. That's something I wanted to clarify. The other thing is, from our church point of view, so we have Spring Mount Church at Salthouse Pavilion. We have a very large church congregation, so we've not been able to implement things in the same way as other faith-based organisations have been able to. We also are not. We're an independent church, so we don't have the guidelines from places like the Church of England, the Baptist Church, Methodist, but we have really followed, obviously, their guidelines very closely for ourselves. But again, it's sort of how do we look at how many people we can have in that building safely? When I talk about a congregation, we have a congregation of about 250, which is probably the combined congregation of all the other churches in Barrow. So supporting a lot of people, and we actually have only opened for the last 2 weeks. Everything else has been online, and we started live streaming about 8 weeks ago from the building rather than at home, with a limited team of 6 in a bubble. So for the last 2 weeks, we've had people in the building, but that hasn't gone over 25, and they've been very separate. But, you know, we've offered this, rather than offering it out large scale, we've offered it to people that are struggling with addiction, mental health, people that are isolated and on their own in vulnerable groups that were able to come. You know, it was more not physical things that were stopping them from coming. Because it's balancing that faith element with the fact of the mental health and well-being. But how do we decide as a church how big we allow that to go, and if indeed with these lockdown measures, if indeed that is safe? So we would have a single person on their own 2 meters apart from a couple who would be 2 meters. You know, everyone's masked. We're following all the guidelines. We're track and tracing. How do we determine, or is that a conversation we can have with yourself or someone?
Again, if you want to drop me an email, or else, I'm happy to pick that up outside of here. But I think broadly speaking, the answer is that in the new guidelines, there's no restriction on how many people can be in a place of worship, but they ought to be able to be socially distancing between groups of 6. So what you're describing sounds like it's the right thing, and you might not be able to get full 250, but there's no restriction on how many there should be, as long as you maintain that distancing between groups.
Right, yeah. Have we got an access to your email, Colin?
It's colin.cox@cumbria.gov.uk.
Wonderful, thank you. That's me, thank you.
Thanks, Roz. I've got Anne, then Vicky, then Dave Taylor, then Les.
If that's me as Anne, that's a legacy hand, and I wouldn't know. I don't know.
Thanks, Anne. Vicky?
Hi, I'm not sure if Colin or Lee would be best to answer this one. Going back to the mobile testing unit and booking appointments, I know that the Barrow Borough Council communications have advised people to either contact 119 or go online to book appointments, and people have really been struggling. It's not showing the Barrow test site as being available. And I think the word on social media is just turn up. Were you aware of those issues around booking appointments, and what kind of advice should we be giving? Because we do sort of have a lot of inquiries from older people about, you know, concerns with symptoms and things and wanting to get tested. So just either Colin or Lee, what's the best advice to give about booking appointments?
No, I can pick that one up. And yes, absolutely, we're very well aware of that. And it was very much because of that we've now got the MTU based in Barrow all the time. But it's not a perfect solution. Two things happen. One has been that places where there was a lower incidence, and because of the national challenges around testing capacity, and places where there was a lower incidence were finding that their MTUs were getting switched off on the national website. So, as you say, it just wasn't showing up. We've to resolve that. We've got it pretty much resolved. Because we've got Cumbria's identified as priorities, so that resolved that. But now I understand. I hear yesterday there are two categories of priority that they've just brought in to try and manage this. And Cumbria's ones are on the second level of priority, so they might still get switched off at certain tests. So we're back to having the fight about that. But then, so I was going to say another thing about that. Oh yes, and so the other thing to pick up is that actually the number of tests that we've been carrying out in Barrow is actually still really high compared to some other parts of the county. So it's been difficult. It has. But a lot of people have been managing to get tested. We're doing what we can. It's a national system that we've got some influence over, rather than one that we actually directly control. And the major challenges here are about the national capacity. In terms of just turning up, in theory you shouldn't. You should have an appointment. Sometimes if you just turn up, people are there and can swap you. You can do that, but sometimes they might not. So you kind of take a bit of a chance if you just turn up.
Okay, thanks Colin, that's great, thank you.
Can I just add to what Colin?
Lee.
Absolutely right. We're aware of the issues people are having, and I think Colin's alluded to it. It's not down to like the capacity to test at the site. It's mainly government trying to relieve the load on the labs. So where you've got people saying, you know, I couldn't get an appointment, but it was empty when I went down there. That's probably why. A lot of people have had success by just turning up, and I think that's not advised. It's not the right way, but I think just from human nature and compassion of the people doing the tests, they don't want to turn people away if they're anxious and worried about the kids, for example. So that has happened, and you probably would, as Colin says. No one's going to stop them doing that. It's not the right way to do it, but I think you take chances with that. The best way is to repair the booking system so we don't get massive backlogs, and we're aware of how much it's needed, and we can adjust the resource to do it that way. But I know Colin's aware of it. I know he's on with it. I don't know if we could advise anything else but that. I don't think, Colin. It needs to be right. It needs to be fixed. Not good.
Okay, thanks, Lee.
Okay, Dave Taylor then, Liz.
Going back on that on the testing. I thought that BAE have an area open to the public for testing, or has that stopped now? No.
No. BAE have their own private testing facility. It's not currently open to the public. I mean, we are talking to them about whether there might be some benefits in rolling some of that out, but it's a different type of testing to the testing that gets done through the national system, so it's not quite that straightforward.
Right.
But we are talking to them.
Do BAE's testing numbers go into the NHS numbers when we come out with the... No, they don't. Why is that?
No, they don't. Because it's a private laboratory. So the NHS reports what's known as Pillar 1 and Pillar 2 testing. And Pillar 1 is the stuff that the NHS does, and Pillar 2 is the stuff that's happening through the mobile testing units. But no, it doesn't play into those stats.
So really...
We get access we know how many there are because
Yeah,
they
so
talk to us directly.
Yeah, so the positive cases would be counted though, wouldn't they? In the overall Cumbria from private,
We count them, but if you look at the national statistics, they're not included in the national statistics.
Right. Okay. Just going back to the children, right? We have a lot of children playing at the park and that, which is fantastic, right? We're not planning on closing the parks, are we, through this?
Not that I'm aware of at the moment. No.
Right. And another question on the parks is that how do we maintain cleanliness of all the equipment? That makes sense.
That's a good question because it's not as easy just to get people out there wiping it all down. I'm not sure how you would best do that.
Right. Want to work on. Okay, thank you.
Thanks, both. Last person I've got indicating at the moment is Leslie.
Hello, everybody. I've put it in the chat, but a lot of the questions that have been posed this morning, as valuable as they absolutely are, and we need to get the word out there, if you contact me as first port of call, I can probably field about 90% of those questions for you. And advise you and guide you, and there'll be the odd issue where I go, hang on a minute, I haven't got a clue, but I can find out. But most of it I am clued up with, and I don't want to clog Colin's inbox up when he's probably got a million other emails that he needs to deal with. So that's my offer in terms of Barrow locality.
Thank you, Les. I appreciate that.
David Proctor, did you just want to come in?
Yeah, from just listening in, and it's the main thing that we've got to try and do with all our partnerships is try and prevent this disease spreading even more. I mean, even at work, we're moving lockers, we're getting rid of desks, we're spreading people out in our own stall, trying to stop it from spreading. Police officers now double crewed in vans will have to wear the face masks to try and stop the spread. You said earlier on about the enforcement side of things and from the policing. It's got to be raised to my senior bosses in respect of it and how we are going to enforce it. Every single one of you know me, and I shoot straight. We are short numbers of police, desperately short. How we're going to enforce this, I really don't know. We are using the 4E approach, which I think everyone's heard. It's engage, encourage, educate, and then it will come down to the enforcement side of things. But, each person's going through loads of their own anxiety, depression, own mental health, welfare regarding the kids and everything. And they'll be sneaking a gathering here and seeing friends and family. We all as individuals have got to tell our friends and family that we've got to try and stop it, and it's just going to get worse, isn't it? Unless we do something about it. I don't think enforcement is the right way to suddenly go. I mean, the last thing you want is a massive fine because you've had 6 people at your house or something like that. But we do need to get the message out and educate folk that it's going to be here for a while. Everybody keeps saying when we go back to normality, when we go back to normality. I don't see normality happening, folks. I think we're going to have to write our paths now on for the future and how we're going to go about it. Whilst this has been going on, my emails have been pinging, and my bosses are wanting to have meetings with us force-wide on where we're going to go with COVID and how we're going to do it. No doubt we're going to have loads of calls coming in saying so-and-so's had a party and whatnot. We'll have to address it. But it's a long uphill battle, I'm afraid.
Yeah, absolutely, David. And just so everybody else is aware, the other thing that has happened last week in light of the rising situation, particularly in Barrow, but also across the rest of the county, is that we've re-stood up the Strategic Coordination Group, which meets essentially mostly it meets in emergency these situations, and we've stepped it back up to provide a little bit of additional support into coordinating work on this. And one of the things that it's doing is establishing a working group to look at enforcement. So the police are chairing that, but very much bringing into play the county council trading standards officers who are responsible for enforcing the things where we've got powers, and the district council enforcement officers around licensing and environmental health and other forms of public protection. So we're trying to find a way of getting a common approach to this. And as you say, we've always said we want to try and do this by consent. We don't want to be enforcing. And the police approach to this with the 4Es is where we want to get to across the board, I think.
Thanks, both. I'm conscious of time, so we've just got one final person indicating, so that's Janine.
Hey, this is just a really quick one. I think a lot of it comes down to kind of clarification, doesn't it? I know that there's been some pubs mainly, actually, and restaurants that put a post out yesterday as they were sent by the local breweries that said that all people must wear masks walking in, walking out, walking to the toilet, going to the beer garden. They must wear it here, they must wear it there. And then apparently they've had a phone call this morning from our local council licensing telling them different. So I think it's about that clarification. So particularly, I mean, you can have a look if you want. It's on the Newton Arms page, their Facebook page. So last night they said they had to enforce everything, or obviously licensees could get fined. I think it's up to £4,000 if they're not enforcing the mask wearing and things like that. And then they've had another bit of guidance this morning that goes against what they were told yesterday. So I think it's definitely just going to be down to that absolute clarification for people. Don't know how we definitely do that. But I think that's one of the biggest problems right across with every organisation, every restaurant, pubs, everybody. So I don't know, it's a bit of a challenge ahead, isn't there, I think?
Yeah, absolutely. Absolutely. Agree.
Thanks, Janine. And I think that just cuts across everything we've talked about today, from schools to like say licensees. It's that consistency in how we try and get that communication out there, and how we support that messaging, both as a local group and as individual organisations. Thank you so much for your time today, Colin. Is there anything before you have to dash off to probably a horribly full diary else that you want to kind of flag or say today to us?
No, it's all right. I mean, this is really important, and while we've been on this, I've missed a call from one of the radio journalists in Barrow because he wants to talk to me, but I'll have to get back to him. So I'm trying to make sure that we do have good conversations around Barrow in particular because of where you're at the moment. So I'd be very happy to come back onto this. I think these are important conversations to have. So if you want me back, let me know when.
Thanks, Colin.
Thanks,
appreciate
Colin.
that. And I suspect the group will take you up on that offer in future.
Brilliant. Thanks very much, and thanks again for everything that you're all doing.
I'll just phone you, Colin.
Okay, Bill, thanks very much. Bye now, everybody.
Bye.